Nice. Okay, good afternoon, everyone. I'm Dr. Yutao Xiang from the University of Macau. Actually, Macau is part of China, I also came from China. And today I will share a study entitled Suicidality and its relationship with internet addiction among adolescents in China during the COVID-19 pandemic. Last year, in October, I visited Antalya, Turkey. Very impressed at the very beautiful coastal city. This year, due to time conflicts with teaching, so I cannot go to Antalya physically. I have to give my talk online. Now, when I attended international conferences before, a lot of friends asked me, "Hi, you came from University of Macau, right? Where is Macau? We know Beijing, Shanghai, Shenzhen, Guangzhou, big cities in China very well, but we have no idea where is Macau." Actually, Macau is very clear to Hong Kong. I believe most international friends are very familiar with Hong Kong, right? Actually, Hong Kong is located in the east coast of the Pearl River. In Chinese, we call it Zhujiangkou. And Macau is located on the other side of the river. And previously, we have to travel to Hong Kong by ferry around 1 hour trip. But several years ago, a couple of years ago, Chinese government built a very long cross strait bridge. Actually, as far as I know, it is the longest cross strait bridge in this world. I highly welcome our friends, our international friends, to visit Macau and Hong Kong. And here are buildings. Here are the pictures of Macau. From the first picture, you can see there are European buildings. Why in a Chinese city there are so many European buildings? The reason is that before 1999, Macau was run by Portugal, and in other words, Macau actually was the Portuguese colony. And in 1999, Macau returned to China and became a special administrative region of China. And Macau is also a very rich city. For example, before the COVID-19 pandemic, the GDP per capita in Macau was around $8,000 per year, ranking the second one globally. And obviously, the economic in Macau was terribly influenced by the COVID-19 pandemic during the past 3 years. The topic of this symposium is children and adolescents, right? So before I start my talk, I will briefly do a very quick literature review. In Web of Science, if we entered suicide and the children or adolescents, actually we can see more than 1,000 search results suggesting that actually this is a very, very important and very, very popular research area. I also analyzed the relevant publication using bibliometric analysis. On this slide, we can see here are the journals that are published most publications in this area. The first one is Journal of the American Academy of Child and Adolescent Psychiatry, followed by Suicide and Life-Threatening Behavior. The third one is Journal of Adolescent Health. The next one is Journal of Affective Disorders. I believe most of our audience are very familiar with these journals. In the future, if we hope to publish relevant articles, we could try these journals. This slide actually indicates the most active researchers in this area. For example, the three include Dr. D.A. Brandt. He or she published around 60 publications on suicidality and adolescence, followed by Spirito A and after A. Seems that all of them actually are Western researchers, no Chinese researchers. I mean, from the name of these people. Here are the most active institutions in the area of suicidality and adolescence. The most active university, actually, Harvard University. You can see researchers from Harvard University up to now, by now, have published around 130 publications, followed by Columbia University and the University System of Ohio. And most of them actually are located in the US. On the slide, we can see the connection between different researchers in this area. Once again, from the name of the very influential researchers in this area, most of them actually, I believe, from Europe or North America. This slide indicates the cooperation, the connection between different institutions. You can see on the left column of this slide, most of the very active universities are located in the US. For example, Harvard University, Columbia University, and the UPenn University of Pennsylvania. On the right side of this slide, they are active institutions on this in this area. I believe most of them actually are in Europe or in Canada, such as Karolinska Institution and the McGill University. Here are the major keywords in the relevant areas, and as I indicate at the bottom of this slide, you can see actually the blue color indicates the very earlier publications, very earlier research areas in this field. I mean, on the topic of suicidality and adolescence, and in contrast, the yellow color indicate recent popular and important areas on these topics. Time is very limited, so I will not introduce all the details. Okay, next, I will briefly introduce the introduction section of our study. During the past couple of years, during the COVID-19 pandemic, actually, suicidality and internet addiction has been gaining increasing concerns globally, not only in China. I believe it is also this case in other parts of the world. For example, a large-scale study in China found that the overall prevalence of internet addiction was almost 40% in the general population during the COVID-19 pandemic. And also, researchers found that internet addiction actually was associated with negative physical and mental consequences, particularly suicidality. However, a common limitation of research is that most of them actually use, the total score of standard scales on internet addiction, and right? However, both suicidality and the internet addiction consists of different symptoms, right? And each symptom, have individual neuro psychological mechanism. So, strictly speaking, we should explore the relationship between suicidality and the internet addiction at symptom level. And in the past several years, negative network analysis is a very new statistical approach that has been widely used to examine the interrelationships between different psychiatric symptoms, such as depressive and internet addiction symptoms in this study. In this project, we conducted a network analysis of internet addiction symptoms and suicidality among primary and secondary school students in China. Now I will move on to the method section. This is a multi-center and cross-sectional study, and we used cluster sampling method. And this research actually was conducted in Shanghai, China. And one school from each of the 6 districts in Shanghai was invited to participate in this survey. And to be eligible, participants should be primary and secondary school students during Shanghai, China, during the study period. This study was conducted during the COVID-19 pandemic. Study, we assess the severity of internet addiction using the self-reported internet addiction test. In this scale actually has a total of 20 items. We measure the severity of suicidality, including suicidal ideation and the suicide plan, using 2 standardized questions. The first one is, have you ever thought about killing yourself in the past 2 weeks? This question actually was used to measure suicidal ideation. The other question we used to measure suicide plan is that, have you ever made a plan for committing a suicide during the past 2 weeks? Those who answer yes to any of the 2 standardized questions will be considered as having current suicidality. In the data analysis, we use the network analysis. With our program, in the network model, each symptom actually is displayed as a node, and the association between different symptoms. Between different suicidality and internet addiction symptoms is defined as an age. Now, I will briefly introduce the results section. In total, more than 5,000 Chinese students, half actually were male, and the other half are female, participated in this study. You can see actually the prevalence of internet addiction is very surprising. Almost 60% of the participants reported having internet addiction during the study period. In contrast, almost 15% of the participants report having current suicidality, including suicidal ideation and suicide plan. Here are the results of the network analysis. And briefly speaking, in this study, we found that three very influential symptoms in the network model, including IAT16, it is request an extension for longer time spent online. The second influential symptom is IAT20, it is depressed or nervous only while being offline. Last one is IAT14, it is sleep loss due to last night logins. Now, let's go to the discussion section. In the study, we found that around 60% of students had reported the internet addiction, which was obviously higher than the corresponding figures reported in other studies using the same assessment tool, using the IAT scale. Also, during the COVID-19 pandemic, in China, very strict public measures have been adopted. For example, school closure, and during this period, all students need to take remote classes and online courses at home. So obviously, the risk of excessive internet use and internet addiction will be likely increase as a result. And also, it is also this case. The reasons are very similar for the risk of suicidality. The results of the network analysis indicate, the most influential symptom in the model is IAT16, and the clinical implication behind is that in clinical practice, actually specific interventions targeting self-control could be considered because it could effectively reduce the risk of future internet addiction. Based on the findings of the network analysis. Also, we found that a very important age, it is the connection between suicidality and IAT4. It is form a new relationship with online users. It is the strongest positive connection linking the suicidality and IAT communities. This result supports the hypothesis of interpersonal psychological theory of suicide. Due to limited time, I will not introduce the details here. And hence, for children and adolescents in China with the risk of suicidality, interventions that can increase feeling of connectedness, perceptions of self-worth, hope, and belongings, these things could reduce the risk of suicidality. Time is running out, so now to the conclusion session. Based on the results of the network analysis, we found that internet addiction and suicidality actually are very common in primary and secondary school students during the COVID-19 school closure period in China. And actually, they have close, they are significantly associated with each other. Also, we found that the very influential symptom, it is the IAT16. We also identified a very important age. It is a connection between suicidality and IAT4, that is form new relationships with other online users. In clinical practice, we could target, the identified central symptoms at identified age, and by using this method, if we could develop relevant interventions and treatment, we could effectively reduce the risk of both suicidality and internet addiction among primary and secondary school students. Actually, the main report of this study has been published in Journal of Affective Disorders. It could be available on PubMed. If any audience are interested in this paper, you could download it on PubMed. Here are two pictures indicating the beautiful view of your University of Macau. In the first picture, actually, you can see my students are watching sunset. On the second view, it is a picture of sunrise. I highly welcome our audience, particularly friends from Turkey, to visit Macau, visit China. Okay, this is the end of my presentation. Thank you very much for your attention.